Hello. Development of clinical professional standards for liver transplant nursing. Michelle Clayton, Lynda Greenslade and Kate Jones on behalf of the Royal College of Nursing, the British Liver Nurses Association and the British Liver Transplant Group. Here are our declarations. Nurses are the largest group of healthcare professionals in the UK and as such are a valuable resource and integral to making an impact on liver disease. Following the success of the Royal College of Nursing publication Caring for People with Liver Disease, a competence framework for nursing, we recognised that the area of liver transplant nursing was underrepresented across the UK. The development of new clinical professional standards would promote consistency in care delivery for both the specialist transplant centres, of which there are 7, and their referral hospitals. The competencies describe high quality pre, peri and post-transplant care for liver recipient transplant coordinators, clinical nurse specialists and ward nurses. Staying healthy following liver transplantation was included in recognition of the potential complications that arise longer term, but also to reflect the increasing longevity of people following a liver transplant. These new competencies complement the original set of liver competencies. For example, you may have nursed a patient with decompensated liver disease and difficult to manage ascites. Their refractory ascites becomes the indication for a transplant assessment. The transplant competencies take you through the intricacies of the transplant journey and possible outcomes. Following transplantation, the focus is to move towards a healthy lifestyle, but recognising the potential complications that arise from being a liver transplant recipient.
Emphasis has been placed on benefits of the framework for practitioners, employers, patients and the public, being able to define expected knowledge, skills and behaviours for practitioners, and to offer a clear framework for both employers and practitioners with regard to the expectation for delivery of high quality evidence-based care from which the care can be benchmarked. The framework can be used to support evidence on liver services, in brackets IQLs, in brackets standards, which many trusts across the country have signed up to. For patients and the public, this framework will provide assurance that liver transplant centres and their referral hospitals are delivering high quality and consistent care across different regions in the UK. As discussed previously, the value that the nurses bring to care delivery, contributing to treatment and management and leading nurse-led services, makes a positive impact on the experience of people with and at risk of liver disease, including liver transplantation. The framework is another example of demonstrating the worth and commitment of liver nurses to improve the experience of patients with liver disease. With the national shortage of nurses, there is pressure to attract nurses to individual specialities. The framework offers clear links to career progression from newly qualified registered nurses through to experienced senior practitioners and is complemented by the wider document to offer a career pathway through hepatology and liver transplantation. We're planning a survey to include a number of liver nursing groups to review the implementation in practice and identify areas of challenge. Although this framework has been developed for the UK, we believe that there is an opportunity to develop this document more widely. Our next step is to approach the EASL Nurses and Allied Healthcare Professionals Task Force to discuss the framework, and our aspiration is to create a European liver nurse competency framework. We hope that you will download the full document from the RCN website free of charge. RCN members can order hard copies from RCN Direct, and we would welcome feedback from any of you liver nurses or your colleagues, and use that email on the poster to contact us. Thank you for listening.